Hey everybody, alright, here's what's up. Let me fix this again. Alright, there we go. Alright, to go into more detail from yesterday's doctor's appointment, I will show you what is going on here. As soon as I fix this camera for the third time. Alright, this is called editing. Alright, here we go. Alright, they gave me some stuff. This is all my insurance papers, Aetna stuff from work. It's a ANS, short-term disability, FMLA. It's Family Medical Leave Act stuff. I fill out the first page. It's just general information, what I do there, my job, what it entails, and then the rest of the other 6 pages is the doctor fills out. I guess what was done, how long till I can come back, all that other information that they need. Second thing they gave me was this book. It's a surgical guide to bowel surgery. Yeah. What they're going to be doing, and they show you in actual pictures here, not to be graphic, but I'm going to cover this part up. Because for some reason they show a woman all the time on these pictures. Alright, so here's what they're going to do. Here. The picture on with all the poking and prodding. That's what they're going to do. I'm going to have 5 cuts in me. Those 4 plus an additional one on my belly button area, 2 inches up and down right above my navel. So the reason why I'm covering it, they always show a woman on here for some reason. I don't think it's appropriate to show on that. So that's what it is right there. It's a surgical thing on the right, with all the other one is the more invasive slice down the center. That's old school. This is new school. This is stuff they do nowadays, which is a lot less invasive, a lot less chance of infection, a lot quicker recovery time. So that's what that is. All right. And they explain all the other stuff that you have to do. Got to call your doctor the night before. And then these things here, they give you 6 packs of these antiseptic wipes that after you shower the night before, you wipe your entire body down with these wipes. They give you packs. They give you this big pack. It's behind this paper here. Hold on. There's it. They give you 6 packs for the night before and 6 packs for the day of. The day of is after you wake up. Right before you leave the house, you're supposed to wipe your entire body down with these antiseptic. It helps with infection, with your surgical incisions and all that other stuff, so you don't get the infections. It helps. And then what's really weird, I thought, that's not usually like a colonoscopy prep, is they want you to drink one of these juices. I don't know if you can see it. One of these juices right here. And basically it's apple juice, iced tea, cranberry juice, or lemonade. Now if you choose the apple juice, you have to drink 29 ounces the evening before surgery and 14 ounces the morning of. If you go with the iced tea, it's even more. It's 37 ounces in the evening and 18 ounces in the morning. This is in addition to all your prep stuff you have to do, the drinking of the other stuff, which is, I'll get into in a second. Cranberry juice is 22 ounces in the evening, 11 ounces in the morning, and lemonade, 34 ounces and 17 ounces. I'm going to go with the cranberry juice because apparently with the prep, you have to take, this, it's called Miralax, 238 milligrams of Miralax, and you mix it with 64 ounces of Gatorade or Powerade, and that's just the big bottles. And you mix it with that, and it actually isn't bad. This is the best prep I've ever had with colonoscopies, and it's the same similar prep. And it just tastes like Gatorade. You just mix the Miralax in it, but you got to also take these Docalax tablets is what you take. I believe it's 2 tablets. So you got to take that, but the drink has to be really cold. You have to start this prep at 3 p.m. and start drinking this stuff for 2 hours, I think it is. You drink 8 ounces every 10 to 15 minutes. until you drink the entire 64 ounces. And if you have any discomfort, you're supposed to stop. And basically, you go to the bathroom until it's clear. With a normal colonoscopy, I usually stop when it's clear. But with this in particular surgery, I'm going to drink all of it. And that's what I'm going to do. So because this is a whole different ball game with that. So they give you, I got to bring a photo ID, and that's all I can bring. I can't wear my wedding ring. I can't wear any jewelry, nothing. Just a photo ID and the clothes on my back. My overnight bag and stuff like that, the wife's going to bring when she comes in to see me. She'll bring it in when she comes sees me after the surgery. So it's a total between the time I get there at 6, which is at my report time as of right now. I'll know 11 o'clock on Monday night, 11 a.m. on Monday morning when I got to come in Tuesday for sure. They said 6, so it's probably going to stay 6. So you figure 6 o'clock, an hour and a half until surgery, so 7:30 they'll get me in. And it's the 4-hour surgery, 7:30 to 8:30 to 9:30 to 10:30, 11:30, at least an hour in recovery. That's 12:30. So that's 5 hours? 6 to 7 to 8 to 9 to 10, 11 to 12. Okay, it's 6 hours. It could be longer. They say 6.5 to 7 hours till someone can come see you. So she's not going to be waiting there long. One of our good friends, Holly, is going to. She actually took a day off of work so she could be with Kemi while I'm in surgery, which is awesome, and I really, really appreciate that with her, because I'm more worried about her than myself, because she has to actually wait. I'll be out cold, so I won't know what's going on. So that's where that is there. And you must call the day before. They frown upon that, I'm told, if you don't call to get your exact time of arrival, which makes sense. So that's what that is. Okay, this book gives you all this information about morning after. That's that thing that you do the morning of, and how they prep you. This is your surgical Bible. I'm supposed to take this with me. I have to carry this with me. It helps me understand. I'll have oxygen mask after the surgery. They'll actually have a catheter for peeing. You can see they have it hooked up in the picture here. I think you can see that. Yeah, it's that little thing right there. So I think they pull that out after recovery, or maybe they keep it in the rest of the day, so you're not allowed to move the rest of the day. I'm guessing it's going to stay in, which is kind of weird. It's the first time I've ever had a catheter in, so I'm a little freaked out about that. So I'm sure it's no big deal. Then they give you a pain scale. There's the pain scale. If you can focus on the pain scale. You're supposed to study this and concentrate on it, and when they ask you how your pain is, you give them a number between 1 and 10. And worst pain possible is unbearable is 10. An idea 2 is mild, annoying pain. 4 is nagging pain, uncomfortable, troublesome. 6 is miserable, distressing. And 8 is intense, dreadful, horrible. So I'm told not to be a big man about this and refuse medicine. She said if you're in pain, you're in pain. You let us know. And they give you exercises to do in bed. I probably can't see it, but it's foot exercises to stretch your legs out. And then they give you this breathing apparatus. Right there it is. It's so you inhale as much air as you can, because after surgery like this, your lungs compress, and if you don't widen them right away, if you don't expand them right away, you could get pneumonia. So that I have to do this. I have to breathe 10 times a day, exercise repeated breathing 10 times a day, deep breaths, and I have to do this 10 times an hour. 10 times an hour I have to do this. So and then they also give you, in the next day in your room, you get help sit on a chair, and then they give you gum to chew on. There's a picture there. They show you gum, liquid diet stuff, because gum activates your intestines and activates your enzymes to start digesting food. Then they get you into meals slowly. 2 days after surgery, you have to start walking 4 times a day up and down the hallway. You're still doing your breathing treatment. And then no baths when you get home. Showers only. Easy on the incision, just mild soap, rinse it off, pat dry. Then they give you kind of a diet, what you can eat and what you can't eat, what you stay away from. Skinned vegetables like apples with skin, tomatoes with skin, any kind of nuts, any kind of vegetables that have a skin on them, because it's very hard to digest. They recommend applesauce, bananas, energy drinks, Gatorade for the electrolytes, Boost, all those protein shake kind of stuff, Special K protein shakes, something that get some vitamins and nutrients in your body, and then slowly you introduce more solids, but you have to chew them very, very small because the opening of your ostoma, they call it, coming out of your body is small. Besides, they gave me a mark. I don't know if you can see it or not. Let me show you. There's the mark. I put a smiley face on it this morning. That's right next to my belly button. That's the mark they give you that's where your stoma is going to be, and that's where they're going to cut you to one of your cuts. There's 5 cuts total, like I said before. And I cannot lift more than 5 pounds 4 to 6 weeks after surgery. So I'm very limited on what I can do, which kind of stinks. They tell you about quitting smoking, which I don't smoke anyway. Any notes you might have in the back, questions you have, they help you answer them. That's it for that. Next thing, really quick, I know this is a longer video than normal. They give you a sample of the bags. 2 samples. These are the bags. So, one, this is the bag. This is the bag here that you'll get in the hospital. It's not clear. This one is. This is the one you will get with this attachment. It'll have this attachment. This attachment in the back is like a seal that pulls apart. It pops off. This part goes on your skin. You cut out this area here to fit the size of your intestine thing coming out of your body, and then it snaps right back into leak-proof seal. Yeah, and then they give you one that's not. They did it backwards, she said, because the one that's clear is the one you wear in the hospital, because they want to see how you're passing your bowels, if they're thick. Make sure they start thickening up to help your body learning to digest with the new system you got going on in there. But this is my nurse. I'll show you a picture of the one that talked to me. This is the stoma nurse right here. I'll show you her information. Her name is Elizabeth. She's nice, really nice person. She helped me out a lot with what I got going on here. But that's all for now. Any questions, leave it on the comments. I will try to answer them on the Facebook comments or the YouTube comments. I really haven't looked at the comments for any of these things on YouTube itself. On Facebook I have. So if you have any comments about any questions and curious, I have no problem answering them. I'm way past the embarrassing points of wearing a bag. It's wear the bag or die of colon cancer or get colon cancer and have a risk of dying. I have to look at it positive, and that's what I'm learning to do. So it's a small price to pay for the rest of my life being slightly uncomfortable or slightly abnormal with my normal eating habits. I just have to eat more meals, less of them throughout the day, like 5 meals a day, small portions. That's it. And just be careful what I eat as far as spicy stuff, which I don't eat anyway. I gotta stay from carbonated stuff when I have the bag. Anything that causes gas, because these things, there are some bags that have a vent in them that you can release air that you might get in them. So that's the one benefit of some of the bags. So I think that's it. I believe I covered everything. So that's where we stand right now. Today's Wednesday, so I have 2 more days of work, and then I'm off for the weekend, and then Monday I start my prep, and then Tuesday surgery. So if I think of anything else, I'll talk to you guys tomorrow. Okay? Thanks. Bye.